Well, I'm here in Nigeria, actually in the north in a state called Kano. Nigeria has over 150 million people, so over 20% of the people in sub-Saharan Africa. And it's got tough health conditions, including being the last country in Africa where you have lots of polio. Of the 4 countries that still have polio, a lot of people were most worried about Nigeria. And the progress that we're seeing this year has a lot of people more optimistic than ever that we're really getting down to the last of this. When you visit a country, you don't know, what's it gonna look like. The population density here is very high, and the number of young kids running around reminds you that the population is still growing a lot here, which as they improve health, that'll come down. But they really need to do more on that because feeding and providing jobs and things, a key element is not getting the population up too high. In the meantime, Nigeria's got to get to higher levels of kids who've gotten the 4 times the oral polio vaccination, which is when you get almost everybody protected. One of the key meetings I had in Nigeria was with the president, Goodluck Jonathan, and he not only met with me, he brought in all the key cabinet people, and we had a great discussion about the progress in polio and how fragile it is. And so I was pleased that it's something he's thinking about, and he's got a strong cabinet. We're doing a lot of work to get the traditional religious leaders to encourage people to take the vaccine because in 2003 there was a rumor that the vaccine sterilized women and the vaccination rates dropped a lot. The energy of these traditional leaders, the kind of ceremonies, it's always a fun thing to engage in, but when they get up to present on the polio campaign, they're into the numbers, so it's not just the ceremony, they really do care about helping reduce disease. Well, eradication is tough because it's the weak link that holds you back. If you just have one state or even part of a state that's not doing its job, then the disease can flourish. Since there was so much virus here in Nigeria over a period of years, it did spread out to most of these neighboring countries. In a sense, although we talked about this being a Nigeria campaign, it's really almost a regional campaign to get things done. We reached out to all the governors, and they've got to reach out to all of the governmental areas inside their state. I was pleased at the response. Actually, in the meeting, there were ideas about who might not be reached right now by the vaccination campaigns. And, there's a sense of excitement that they've made good progress. So I think they'll keep up the energy, and, it gives us a really good chance that we're in the kind of the end game for polio and to raise their vaccination rates quite substantially. Well, it's exciting to see Nigeria bringing their polio cases down. And it's exciting to meet the people who are committed to carrying the campaign forward. Certainly, it's energizing for me. I think the timing, I was very lucky to be here at a time when people had that data, but needed to be reinforced that they can't back off. They've actually got to keep improving. So, coming back regularly, seeing the rate of improvement, it helps the foundation be a lot smarter.